to crack on with the initial presentation. So hopefully you can see that. I can see Les. So Les, can you just give me a nod if you can see the slides?
Yep.
Brilliant, thank you. So yeah, welcome. We've done a quick round in terms of introductions of the panel, just for the purpose of the recording. I'm Emily van der Venter, Associate Director of Public Health with Warwickshire County Council and South Warwickshire CCG. When we come to questions at the end, I'll ask panel members to say their names again, just for the purpose of the recording. So in terms of today's session, I'm just going to take you through a short presentation to give you a bit of an overview of the test and trace system for COVID-19, some of the key prevention measures, and also the pattern of cases that we're seeing in Warwickshire at the moment. At the end of the presentation, there'll be an opportunity to ask some questions. We've had a few questions submitted in advance, which we'll take initially, and then we'll open up to the floor for any further questions. So there's the title of the session today. So in terms of what we'll cover, yes, we'll touch on support to communities, and then I've mentioned the other elements as well. So firstly, wanted to say a big thank you to everybody out there for helping yourselves and others to stay safe and well. I'm going to pass over to Mike just to give a little bit of an overview of some of the support that we've been really grateful to see from local communities. Over to you for a couple of slides, Mike.
Thank you, Emily. I'm Mike Slemensek, Localities and Communities Officer responsible for Nuneaton and Bedworth, and just really wanted to emphasise to say a big thank you for the 304 pop-up groups that and existing groups that adapted their offer to support communities across Warwickshire, and 74 of those groups were actually in the north, so North Warwickshire and Nuneaton and Bedworth. And all of those groups formed part of the COVID-19 Community Support Directory, which we set up to respond to the pandemic and support communities. And the mobilisation of these groups was actually amazing. And the directory can at the moment be used as a networking tool to keep in touch with each other. So that link you can see there takes you to the directory with all of those groups actually on there. So some really amazing work was done by those groups, and also by individual people as well, working on their own, supporting, doing stuff individually. And these groups responded to numerous requests for help directly from residents locally, and also via the County Council's shielding helpline as well. Okay. And so ongoing support from the Localities team. We want to be the point of contact going forward. So when it comes to support for communities post COVID-19, we're looking very much to working with those groups, looking at things like volunteering opportunities, funding, as well as also supporting some form of legacy from those groups going forward. For example, a COVID-19 network group, and helping with test and trace in the later stages of the pandemic. So we want to be in North Warwickshire, Laurie and myself in Nuneaton and Bedworth. We want to be a main contact for you, and you can see our email addresses there. So we're very keen to work together and move forward together. But thank you very much for the great work that you've been doing.
Thank you, Mike.
Emily. Thank you.
Great stuff. So just wanted to show the pattern of cases that we've had in Warwickshire. And to reiterate Mike's point again with the thank you, is to say, you know, the peak wasn't as bad as we had feared it may be. And we've seen a consistent reduction and quite a plateau in cases now. And we couldn't have done that without you, whether you were working in the public sector, the voluntary sector, or just helping out your neighbours in this unprecedented time. So in terms of the pattern, you can see that the peak there, a few kind of peaks and troughs, but overall that peak earlier on has really come down quite steadily. We have had a small number of cases reported over the last few weeks. there's a bit of an error in this one. So actually the 12 and the 9 that you see there earlier in last week was some false positives that were reported by the lab. So we were very relieved to identify those as false positives because we thought we had a number of issues within a couple of care homes. So thankfully that wasn't the case, and we'll get this graph updated. But wanted to show you and kind of reassure participants around that ongoing reduction and really why we need test and trace is to really get on top of those last few cases, prevent a second wave, or if we see a second wave, ensure that it is controlled and we really minimise the impact on communities. So in terms of the key things we should all be doing at the moment, it's obviously staying alert to symptoms, so a high temperature, a new cough, and importantly one that can come on quite early is a change or a loss in taste of smell, in sense of smell or taste. So that can be a helpful early symptom. So most people have at least one of those symptoms. You can get atypical presentations. So do be alert if you start to feel kind of really quite fatigued and worn out. Some people experience some gastrointestinal issues, although that's fairly rare. So those 3 key symptoms are the ones to be alert to. And if you do have them, we'll come on to that shortly, but ensure that you isolate and stay at home and minimise contact with others. So the other key messages that have been around throughout the whole pandemic, obviously around hand washing. So I think people were really active in terms of frequency of hand washing early on in the pandemic. Naturally, it's waned. I noticed myself not washing my hands quite as often as I was earlier on. So just to really help keep that message prominent and keep that behaviour happening. So hand washing with soap and water is always the best. If you haven't got access to soap and water, then to use hand sanitizer. The use of face coverings on buses has obviously been mandatory for a little while now, and having had Boris Johnson's announcement last night, we will see those becoming mandatory in shops and enclosed spaces from the 24th, I think it was. So important difference to face masks, which are the clinical version. Would put the request out that people don't try and buy up clinical face masks. We need to protect those for those that need them, but face coverings can be really effective in reducing the risk of transmission. Doesn't negate the need for social distancing and the other measures around hand washing and respiratory hygiene, but they're a useful addition to our protective armour. And then the catch it, bin it, kill it. I would hope some of you recognise those slogans from, they've been around for many years within the NHS, so often promoted around flu season, but again, really important. So if you're going to sneeze, obviously try to use a tissue, or cough and sneeze into your elbow, throw the tissue away and then kill it by washing your hands or sanitising. So as I say, test and trace is the term that's been used for contact tracing around the coronavirus. So it's the next vital step in really getting on top of any new cases that do emerge. So what it means is that after a case of disease, measures will be put in place to try to identify people who may have been at risk by having contact with positive cases, and trying to ascertain where that case has potentially picked the virus up from and who they've had contact with in terms of potential further transmission from that individual. Now, because it's got a fairly long incubation period, so kind of 5 to 7 days, we do have time to intervene and identify people who are potentially being infected before they go on to infect any others. So we monitor this through national, regional and local systems to really look at what links there may be between cases, or where we start to see clusters of cases emerging. Then obviously we're kind of ramped up into action to identify those. And we will advise on control measures. So if we see cases emerging in a school or a workplace, a pub, a cafe, we will engage with those settings, provide advice around anything that they can put in place to further reduce the risk of future cases. Largely, I would say, based on experience to date in Warwickshire, we have seen odd cases, largely single cases within schools or within workplaces. And because the social distancing and other hygiene measures are in place, we're generally not seeing those develop into outbreaks, which is really encouraging in terms of, you know, reassurance that those prevention measures are in place and are working. In terms of test and trace, so cases and workplaces, etc., will be asked to provide information on potential contacts. I'll come on to what we mean by a close contact shortly. And we would then obviously warn and inform those contacts to stay alert to symptoms and ask them to isolate. So this is hopefully another graphic that you, oh sorry, I've moved on a different slide set. Oh yeah, hopefully a graphic that you will become familiar with. So it outlines the key steps within the test and trace symptom. So the blue side of the screen, if you've got symptoms, as I said, the high temperature, the new cough or the change in smell or taste, then to start self-isolating as soon as possible. You will be asked to isolate for 7 days, so that really does mean avoiding leaving the house for any purpose. Don't go shopping. Try and get somebody to help you with that. Remain in your household, and we would also ask other household members to self-isolate for 14 days. The reason they need to isolate for a bit longer is because generally, as I say, that the incubation period for the disease is up about 7 days, 5 to 7 days before you start showing symptoms, but it can be up to 14 days. So that's why we ask that longer period. The latest science is suggesting it's probably 12 days maximum, but we've got that kind of safety window of 14 days in place. So if you've got symptoms, you also then need to book a test as soon as possible. The window for getting tested and having a kind of accurate result from your test is really those first 5 days of having symptoms. So you do need to book a test as soon as possible. You can do that via the nhs.uk/coronavirus website, and it will take you through a few steps in terms of either booking into a drive-in test centre or ordering a postal kit. Now, the drive-in test centre has very fast turnaround in terms of getting the results back. So you will usually get results back within 24 hours. Obviously, if you go for a self-test kit through the post, it takes a bit longer. Hopefully you'd receive the test kit the next day or within 2 days. And then they advise that they will get the results back to you within 5 days. Hopefully sooner, but the demand on that system obviously means that sometimes it may be up to 5 days. You can also request a test through calling 119. So similar to the NHS 111 service, it's an NHS helpline specifically for coronavirus and requesting tests and getting advice there. So if you're negative, your household members can stop isolating immediately. We would ask you to stop isolating if and when you feel well. So obviously you may get a negative result, but you may have the flu or another infection. So don't go back to work if you're still unwell. But once you are, you can stop self-isolating. You would also, if you're positive, obviously continue with the 7 days isolation and the 14 days for your household contacts, and you'll be contacted by the National NHS Test and Trace Service and asked to provide information on recent close contacts. And again, I'll go on to what we mean by a close contact shortly. So if you are a close contact of somebody, so not necessarily a household contact, but you've had contact within the community or within a workplace setting, school setting, GP surgery, etc., then you would be alerted by NHS Test and Trace, and you would be asked to isolate for 14 days. If you go on to develop symptoms, you need to request a test as soon as possible using the methods I mentioned earlier. If you, and as you develop symptoms, we would ask your household contacts to isolate for 14 days from when you develop symptoms. If you get a negative result from your test, then we advise that you, so your household members can stop isolating immediately, but we would suggest that you continue with the self-isolation for 14 days, just in case there's been a risk of a false positive result. If you do get a positive result from your test, you can begin isolating from 7 days from the date of your of taking the test. So that's because you've kind of become a case, and outside of that 7-day window, you should no longer be infectious. And obviously, if you are well, you can stop self-isolating and return to work and activities of normal living. And we would ask, obviously, your household contacts to still complete the 14-day isolation. There's quite a lot in that, so I hope that was all clear. Just in terms of what we mean by a close contact, so the basic definition really is having contact with somebody within 2 meters. So strictly we say spending more than 15 minutes within a 2 meter, under 2 meters with somebody. So it's not just about kind of walking past somebody, but actually a more prolonged contact with a positive case. Additionally, if you have face-to-face, so direct face-to-face contact with somebody less than 1 meter away for any period of time, you would be considered a close contact. And if you've been travelling in a car or similar small vehicle with a positive case, you would be considered a close contact. So as I say, you can start to see why when we see cases in workplaces, etc., that may consider themselves close contacts. In fact, where the social distancing measures are in place, they are not a close contact, and the risk of transmission to them is low. So just a bit of a flowchart here around what the NHS Test and Trace service will be asking you in the first instance. So identifying any household members, identifying your close contacts, and we go back from 2 days before the onset of symptoms, because you can start being infectious from 2 days before you start showing symptoms, and then the period whilst you are symptomatic. They'll also ask whether you visited places, so bars, schools, workplaces, and GPs or hospital settings where you may come across more vulnerable individuals. And then you'll be asked to provide the names and contact details of the people that you have had close contact with. So when you go out to settings such as restaurants and bars, you'll see they are starting to collect contact details from people now. So that may seem a little bit out of the ordinary, but we would request that you do comply with those asks for information, because it means if a case does occur, we can really quickly get in touch with and identify those close contacts, for where those are people that the individual case wouldn't actually have a direct relationship with. So as an employee, you have got rights, so you should be entitled to statutory sick pay, whether you're a case or a contact. So if you've been asked to isolate due to being a close contact, your employer can either ask you to work from home if that's practical and reasonable. If not, then you would be asked to take those 2 weeks off work, and you should be entitled to sick pay. So there's a couple of links on the slides there to places where you can find further information in terms of your rights there, just in case you were having any difficulties with employers, you can be armed with that information. And just to then talk about how people in the community can really help this. So as help us with our test and trace service, and help us really get on top of the pandemic. So as I've said, providing your contact details when you visit public places. And in terms of social media, we would really request help in terms of getting accurate information about the coronavirus and about the test and trace system on social media. It can be a hotbed for kind of misinformation. So I've shown a couple of tags there, hashtag Covid-19 and hashtag stay alert to stay safe. So if you were to search for Warwickshire in either of those hashtags, you would see posts that are being put out by Warwickshire County Council and other partners in terms of getting those messages out. And if you're really keen, if you want to start sticking posters up in your local community, there's a great set of resources available at coronavirusresources.phe.gov.uk on a whole range of topics, from test and trace to what you should do if you have a positive result, to the prevention measures I've mentioned around hygiene, to supporting your mental health, supporting people who are shielding. So loads of information available. In terms of continuing to support each other, obviously, people who are asked to self-isolate, be it for 7 days or 14 days, may need assistance from people in the community, from neighbours, from friends or family to get essential items. So we would ask that you support people and look out for your neighbours if they're in that situation. Similarly, I know a lot of people within the pop-up groups and the voluntary sector organisations that have been offering support over the last few months have been specifically supporting people who have been shielding. So those with underlying medical conditions which make place them at extremely high clinical risk from serious illness from COVID infections. Now, officially, the shielding support from the government and from the county council ends at the end of this month, and people have already been who are shielding have already been told they can begin going out and about, obviously just being careful to socially distance and staying on top of hand hygiene, etc. However, many people who have been shielding are likely to feel anxious about returning to normal activities. So again, we'd just ask really that you stay alert to people's needs, potentially kind of support people to either remain at home or support them in starting with small steps to come out and get back engaged with normal life, as many of them, as I say, may be feeling anxious at this time. And I really wanted to flag looking after people's mental health and well-being as well. So this pandemic has taken a toll on all of us in terms of our mental health and well-being. We've all been facing challenges and big changes in terms of how we live. So please do be aware of that. If you have any concerns about people, just please ask them directly. We often suggest that people ask twice, because you know what we're like as British residents. We often say we're fine in the first instance, but a follow-up question to say, are you sure, are you really okay, can make the world of difference to enable people to open up initially and hopefully then be encouraged to seek further support should they need it. But just having somebody to talk to can make the world of difference. I also then wanted to flag that actually if you do have any concerns about people not adhering to social distancing or prevention measures, particularly if it comes to workplaces or employers you think are not being particularly supportive, then do report it to the police. So I've put a link there in terms of an online form that you can use to report to Warwickshire Police Force any concerns that you have. Would ask that you don't call 999, and obviously unless it's an emergency, if you don't have access to the internet, then you can always call 111. So it's enough for me for now in terms of talking at you. So I wanted to give the opportunity to raise some questions with our panel members. So I'll just go through the questions that we've had submitted in advance, and then we'll open it up to the audience for some additional questions if you have any. So the first couple, I think, were for me to respond, so I lie. I will keep talking at you for a little bit longer, but just in terms of how and when do I get tested, I think I've mentioned how obviously booking on the NHS 119 or the nhs.uk/coronavirus website, making sure you get tested as soon as you can, really within that 5-day window of having symptoms, and would encourage you, if you are well enough to be able to drive or you have somebody from your household that can drive you, don't ask anybody that's not from your household to drive you to a test centre, then do that because you get the more rapid turnaround of results. And second question, sorry I haven't moved on to them, is whether you can go to your GP with COVID symptoms. So obviously you can call your GP if you need any medical advice, but if you are displaying symptoms, please don't turn up there without having first had a discussion with the GP, who, if you do then need to access health services, can advise you how to do that in a safe way. I do need to give apologies actually for Catherine Johnson from Citizens Advice, who was going to be joining us today, but she was unable at the last minute due to a family emergency. So she was going to be my go-to person in terms of advice around whether employers, I'm skipping a question, sorry, further down the slide, whether employers are not supporting employees to self-isolate. So I would suggest that if you do find yourself in that scenario, to to please call Citizens Advice if you need further advice. There's information, as I say, on the ACAS website, but Citizens Advice can also give you further support. So I think for the third question on the list, I was first going to go to Joe and Sharon from Environmental Health. So just to give a bit of an overview about what exactly employers are expected to do to both reduce the risk of spreading the virus in a workplace and to help with the test and trace system. I'm going to stop sharing now so that you can see who is speaking. Joe and Sharon, you're on mute at the moment.
Sorry about that.
Thank you.
Hi everyone. Yeah, just over the last few weeks, we've been in touch with a lot of employers as and when businesses are coming back to some sort of normality. So starting with supermarket shops. So we're the commercial team in environmental health. So we've sent out all the relevant guidance that's come out as and when. My trusty assistant here is demonstrating. Glamorous, sorry. So yes, so guidance as and when it comes out, obviously from the .gov website. And what we're doing at the moment is we're asking all employers in the hospitality industry, hairdressers, to send us their risk assessments. And we're going through each risk assessment to ensure that they're COVID secure, or offering advice to them if they have any gaps in their risk assessments. A lot of the stuff in the first few weeks of COVID were a lot of reactive stuff, because obviously there weren't many places open. We were dealing with warehouses, sort of areas that the public weren't visiting, so we were relying on intelligence from people there, and that was working closely with the police. We have twice weekly teleconferences with Warwickshire, multi-agency meetings. So anything we hear about from those, we then follow up and offer advice and guidance. And yeah, we're just in contact with them all the time. Obviously, we in environmental health are used to going out enforcing the legislation, but now we're acting in very much an advisory way unless we have any intelligence to suggest otherwise.
Thank you, Sharon, that's really helpful. Was there anything else you wanted to add, Joe, just around what's required in terms of supporting test and trace?
Yeah, the businesses that are doing the risk assessments are advised to take names and addresses. So, for example, if you go to visit a bar or a cafe, when you go to buy it, they will ask you if you can leave your name and your telephone number, just so that if somebody has tested positive and has said, oh, I've been to that certain cafe or bar, then we could go and trace the people that have been there. So that's really important to be able to capture that information, so we can follow that through if there is any positives that have visited those premises. So that's part of the risk assessment that we're asking people to do, and most of them are complying. It's not you know, they don't have to do it, but I think people are making sure that they're doing their best to try and, you know, help the community and to try and stop any further spread. So yeah, that's been very positive.
Yeah, we have done spot checks as well on places. So we've turned up unannounced and we've been asked for our details. So we've gone into a coffee, you know, for a coffee somewhere, locally, obviously, and we've been asked for our number, a name and number. So it's, you know, we've been doing spot checks. So it's working so far.
Great stuff. Thank you, guys. I know you've been really busy with all of the work and all the queries that come in from businesses as well. So thank you. And I would say similarly, where we've had experience of workplaces reporting cases, they've been very helpful in terms of helping us identify any close contacts within a workplace and put those measures in place to support their staff to self-isolate, because obviously it's better to nip it in the bud than let these things rumble on over time, which would have a greater impact on their business. Thank you. I was going to go to our community development and localities colleagues now. So if I go to Becky first, but Mike and Laurie may wish to chip in. So there's been a question asked around what happens if I'm asked to self-isolate for 2 weeks, but I have no food in the house and nobody locally who can help me.
Yeah, so I think a number of the answers to that has already been mentioned, Emily. So on the Warwickshire website, there's obviously a range of services around a number of grocery retailers that are offering food and household goods for delivery or collection, and that can be order online or by the phone. There's also the database of community-led support groups, which I know we've already mentioned. You've also got the hotline that people can ring, so the 0800 number. If people are struggling, they can call that up and get some support. And the NHS Volunteer Responder Scheme is obviously still up and running, and there isn't a date yet that I'm aware of, unless Emily, you've heard otherwise, for when that's stopping. So that service is still available. And I just wanted to make the point as well in terms of what Mike said earlier about volunteering. In that we're obviously doing a lot of partnership works with district boroughs and yourselves and Carver around supporting volunteering. So I just wanted to make that clear as well, that there's a lot of partnership work going on.
Thank you. Definitely lots of partnership work. It's been invaluable, hasn't it, both across organisations and, as you say, with the communities as well. Mike and Laura, I don't know if there's anything you want to add. So what have you got the 0800 number to hand, just so we can give that to the audience? You're on mute, Mike. Sorry. Thank you.
The hotline number is 0800 408 1447. So that's the hotline number that Becky's just mentioned, which anyone can sort of call to get support and advice. So a really important hotline, that one, actually, to bear in mind. Okay.
Absolutely, and it's been invaluable over the pandemic period. And if anybody's been stuck with anything, really, they've been able to be really flexible in the advice and support that they've offered through that hotline. So thank you all for those that have been involved with that. And then perhaps a slightly contentious question. So I was going to go to councillor colleagues. So if I go to Margaret first, because I can see Les has had to take a call, and hopefully we've got Neil Phillips back on with us. So this question was whether we might have a scenario where we have a local lockdown imposed like we've seen in Leicester.
Oh, thank you for that question. That's very good. Thank you, Emily. Much appreciated. Yes, well, obviously, Leicester's proven that it can happen. These decisions are taken centrally. At one point during the pandemic, we were a bit of a hotspot in North Warwickshire and Nuneaton, but I understand now that we're not on the radar. However, that doesn't mean we can relax. So I think the message really is, if you don't want to be like Leicester, then you need to obey the rules. So basically, you need to look after your own health by following the guidelines, and you need to cooperate with the test and trace system and make sure you give your details and make sure that you do as instructed according to your test result. So I think that's the message, really. Yes, Leicester's shown it can happen. Let's make sure it doesn't happen in our area by looking after ourselves and each other.
Thanks, Margaret. Neil, anything you'd like to add to that?
Well, how can you follow Margaret, Emily? How can you follow Margaret? I think she just encapsulated it, really. But we need to work with all the agencies that are going to be out there if we do suffer a spike. Yeah, I fully endorse everything Margaret said.
Thank you. It was very well put. So I suppose I would just reiterate the request for help from audience members to get those messages out through the networks that you have. So keep an eye on our social media, keep talking to friends and family about the guidance that's in place. Appreciate it. It keeps changing slightly, but those key messages around hand washing, social distancing, respiratory hygiene, and now face coverings are absolutely vital. So that was that's covered all of our. Oh, sorry, there was one other pre-submitted question. which I think is probably for myself to respond to, but colleagues from districts and borough councils may wish to interject as well. So this was around what happens if there's an outbreak in a school setting. So it is slightly different in a school compared to workplaces that I've been more closely involved in. So within a workplace, we would count an outbreak as 2 linked cases and we would intervene at that point. Within a school, we're being more cautious because we recognise in many schools some of that social distancing is a bit more difficult to maintain, and obviously want to protect our young people. So if there is a suspected single case within a school, that gets reported to Public Health locally and to Public Health England, and we will immediately start reviewing contacts, particularly amongst staff. So transmission amongst children, the evidence is that there's quite low rates of transmission amongst children, and we are seeing that where we have had individual cases within schools. Actually, it's mainly been staff, and the children haven't, on the whole, been affected. So if a staff member is identified, we would identify any close contacts so that we're prepared for if we get a positive test result back. If that positive test result comes back, the whole bubble, so that's effectively, at the moment, it's the kind of smaller year groups, and as we come into September, we expect that to be a class. The whole bubble would be asked to isolate for 14 days along with their household contacts. If we do end up having 2 cases within a school setting, we would call an outbreak control team. So that's when we get our partners from districts and boroughs in, Environmental Health and Public Health England, and we get the school involved too to determine actually what are the most appropriate next steps. So as I say, we would identify those staff contacts. We may get to a situation where we identify a couple of staff members within a school, and obviously we're asking them and their contacts, their workplace contacts and their household contacts to isolate. So we have had a situation recently where we had to close a school within North Warwickshire, and it was in fact not because of the risk to the children so much, but because the ratio of staff that were available and not isolating to support children was too low to keep the school going. So that's that situation, and then we would monitor it along with colleagues from Public Health England over that 2-week period. And once that 2-week period is up, so long as any further cases that are identified are isolated, then the schools can reopen, and the risk again is very low. So I hope that answers questions from audience members who had submitted questions in advance. And I was just going to give the opportunity if there are any questions or queries from audience members who would like to ask. So Nigel has got a question to pose. So yes, please do pop your mic on and ask a question.
Yes, hi guys. Thank you very much for all that information that you passed on to us. My question and my point is that we in the very, very northern part of North Warwickshire have found that the majority of those particularly vulnerable are the elderly, and they do not have smartphones, they do not have internet, and therefore our support groups have been doing the knocking on the doors, the leaflets through the doors and all that business. How does this help them with regards to track and trace when they do not have such technology that is hopefully being relied upon in order to track any outbreaks or contact they might have had with others?
So certainly for individuals who don't have access to the internet, they can still request testing through the 119 telephone system, and we would encourage them to speak to their GP as soon as they get symptoms as well, if they are in that more vulnerable group. Part of the point around test and trace is not just about kind of protecting ourselves, but obviously we are protecting others. So if we get test and trace working really well and we get all those prevention measures in the community, then actually it will have the knock-on effect of reducing any risk of transmission to those more vulnerable groups. I don't know if that answers your question fully. Are there any other questions?
It sort of does, yes. And I do have another question, if I may, because you did bring the issue up in one of the slides, and that was with regards to mental health. Mental health is sadly still quite a taboo and a frightening subject for anybody to talk about, or for most. With GDPR, with data protection, and with the sensitive nature of the subject, if a volunteer does come into contact with anybody that they do fear is perhaps going over the edge with regards to their mental health issues, what is the best way to actually get that reported without being considered invasive or a busybody and all those other words that I probably could mention?
No, okay, so that's a tricky one in terms of accessing support. Obviously, it requires the individual to go ahead and access that support. I think the best thing you can do is ask somebody how they're feeling. As I say, ask twice. If you have concerns, actually to ask, it's a very difficult question. Talking about taboo, it may be even harder, but if I would really encourage, so my normal role outside of pandemic is mental health and wellbeing lead, particularly around suicide prevention. And one of the key messages we promote around suicide prevention is actually to ask people quite directly if they've ever had suicidal thoughts or if they have had concerns about ending their own life or harming them. I know that can be really difficult to ask, but actually it can be a real lifeline in terms of giving somebody that opportunity to open up. And just to feel normal, actually. Feeling suicidal, as extreme as it may feel, can be a very natural response to when the challenges of life become too much and you've got to that point where you don't feel you can see another way out. In that situation, would advise somebody to call the Samaritans, so 116 123, and in terms of your individual response, whether it's to disclosures of suicidal thoughts or just general mental health challenges, the most helpful response often is just to listen and to tell people that actually it's normal to, it's very understandable to be feeling the way that they're feeling. These are difficult times for all of us. So don't try to be judgmental or anything, and just encourage them to seek some support where they can. So I've given you the Samaritans number as well. We've also got a lot of resources that we'll send out to members of this webinar around the mental health services and support that are available at this time. So we've got a mental health pack which gives details of all the support that's available. They've all adapted their offer so that people can access them in a safe way. So often for digital support, telephone-based support, or face-to-face is still available when needed.
I hear what you say, but I'm sure that you understand that a lay person who is simply a neighbouring volunteer, they're not a mental health professional, trying to bridge that gap and persuade an individual to reach out to the professional sources is a very, very delicate and a very daunting process for them, perhaps to even be put into. But I think all we can do is maybe print out that information, have that conversation, and leave that with the individual, and hopefully that they will take up the conch and pick up the telephone if they feel as though they do need that support.
Absolutely. So we'll make those leaflets available. I mean, if you are concerned that somebody's in immediate risk of danger to themselves or others, then you can call 999. Okay. But for that lower level, yeah, absolutely, it's letting them know that you're available as a listening ear, and you can help to signpost them to support when they're ready to do that.
I'm grateful for that. I'll let somebody else take the position. Thank you.
I suppose it's an opportunity to flag some support that's been offered through the Shielding Hub as well, which is where individuals have made contact through that 0800 helpline number and expressed that they are struggling and they are feeling lonely. We've had volunteers from It Takes Balls to Talk, which is a great local organisation that does lots of campaigning, particularly around getting men to talk about their mental health. Usually going out to sporting events, but during this period they've been offering phone support for kind of a 6-week period initially for people who are feeling particularly lonely and are struggling. Similarly, our Key Rings service, which we commissioned from the County Council to provide support in communities, has also been helping with that offer. Did any other panel members want to come back on that question as well? Okay, thank you all. Sorry, I'm not doing very well of keeping an eye on the chat function. So Amanda, if you're there, is there any questions that have come up in chat that I've missed? I'll have a quick scan.
Yeah, there's one, Emily, that's come from, that's for the environmental team in terms of risk assessment. So is it just hospitality establishments that environmental health would check risk assessments for? Would you do a check for, say, a community centre?
Yeah, we're asking everybody to send us in their risk assessments. Community centres, hairdressers, tattooists, Hospitality, yeah, everybody we're asking for risk assessments at the moment.
Great, thank you. And Laurie's just put some information up about the mental health support and the link there on the chat as well.
Brilliant. Thank you.
Amy Greenhoff's got a question as well, I think.
Yeah, she has, yeah.
Hello, thank you. So we work with the Hilltop and Caldwell Big Local, which is a area covering, funnily enough, Hilltop, Caldwell, and around that area around Chilvers Coton. We've got a direct newsletter that's going out to our 1,700 households. And while you were here, I was going to ask, is there any messages that want to come out from Public Health that you would like us to target direct to that group of residents?
That's a very kind offer. Thank you, Amy. So as I've said, I've been reiterating the messages that have come out today around prevention and hygiene measures and adherence to the test and trace. Obviously, if they making people aware of symptoms, and if they have them, to isolate and to request a test. But perhaps we can discuss following the webinar as well around any more kind of particular messages that might be helpful for that specific community.
Okay.
I think has been touched on by Nigel, actually, information around the mental health support as well is really helpful to get that out far and wide at the moment.
Have you got the message from the question from Claire Edwards as well, Emily?
Okay, I will just go to Margaret, who I think wanted to come in on Amy's comment, and then we'll go to Claire. Thank you. Margaret, do you want to come in?
Mute.
She's on mute.
Oh. You're muted again. Margaret, you're very animated, but you are muted.
Thank you. Is it on now? Because it keeps turning itself off, I'm going to just... No, I was going to say, sorry, I've got a question. It wasn't an answer to that. So if that's okay.
Fire away then, and then we'll go to...
It's actually a question for Neil, if he's there. I just wondered what the community response had been to the school closing, and whether the communications out to the community were effective, and as I say, how they've responded.
To be perfectly true with you, Margaret, I don't know at this present moment in time. I think Public Health and the schools have done really well in the fact that it came from a support worker, and then the person who maintains the school had a lot of contact with the teachers as such, but I don't know what the present outcome is at the present moment in time. Do you, Emily?
No, sorry, I haven't been directly involved. No, so I know. Yeah, no, I don't know how the community's responded. Apologies.
Hello, sorry, I do a little bit, and apologies for interrupting you. My daughter actually goes to that school, so the communications that came out were very clear, they were very precise, they kept you informed as they were going along. It was mainly through the parent mail facility that we found those things out, and it's also a school that's just on the edge of our designated area, so there wasn't any feeling that we picked up on from within our community about concern or issues. There was no sort of heightened agitation that we certainly picked up on anyway, but we aren't everywhere. Thank you, sorry.
Thank you, Amy.
Emily, I've got to go because I've got to get to another meeting.
Okay.
So can I just thank everybody for the excellent work they're doing in partnership across your area. It really is brilliant, and let's all keep it up and then we'll beat it. Thank you all very, very much.
Thank you, Les. Lovely words there from Les Caborn. Thank you. And lovely feedback to hear, Amy. So yeah, sounds positive in terms of the community response and the communications that went out to parents. Thank you. And then a question from Claire on how many mobile... Sorry, Claire, do you want to ask the question yourself? Rather than me speaking for you. I don't know if you're muted, Claire. You still with us? I will... Oh, are you there? I'll crack on and ask the question then, because I can't hear you at the moment, Claire. So it was a question about how many mobile testing stations there are in Warwickshire, as the home testing can take several days to sort out. And yes, granted, the instructions on the packaging is quite complicated to follow. So we have 3 mobile testing stations across Warwickshire at any one time. If you go through the NHS system, they will tell you when and where they are available and where they're open. In terms, and you can access them at any time, really. Well, I say at any time, I think it's between the hours of 11 and about 3:30, because they have those requirements to kind of collect the tests and get them back so they can do that 24-hour turnaround. They're mobile in a sense, so they take a day, so 24 hours to move from one location to another location. So at the moment they stay in one place for kind of 4 or 5 days and then they move to another location. But if we need to call one in for responding to an outbreak situation, then we can do that. And we have we've got military colleagues at the moment who are working to scope out which locations across the county we can locate the sites in, because there's obviously certain requirements around the space and access for them. I think they've almost completed that task, and they were looking at 30 sites. Nods from Laurie, great. So 30 sites across Warwickshire, which would mean that we could place a mobile testing unit within a location that any area within Warwickshire would be within 12 minutes from one of those 30 sites. So we will have really good coverage in terms of being able to respond quite flexibly to those mobile testing units. But if it's not kind of an outbreak response and you need to get to one of the stations, then you would have to look and it may be more than 12 minutes away. But yeah, the information is all available online or via 119.
That's useful. Thank you very much.
Thank you, Claire. And I can see there's a question from Teresa Howley. Do you want to come in and ask? Sorry, all the long comments there. Oh, fantastic. Making some face coverings with the help of a grant from Warwickshire County Council, supplying mostly to the food bank. Anybody who would like to acquire a face covering, they can do that through the Facebook page. So do you want to, sorry to read that for you, do you want to come in, Teresa, and just say a little bit about your Facebook page? Maybe not, but thank you very much for flagging that and for the hard work that you're doing with your group there. That's really fantastic. I don't know if in the chat you can perhaps paste a link into your Facebook page so people have got access to that information. Both, so I should have said at the beginning, obviously we've recorded the webinar, so we'll make it available to the public through our website, and we'll also capture the comments from the chat function as well. I can't see any other questions. Amanda, have you spotted anything that we've missed?
No, I think we've covered everything in the webinar.
Brilliant. How's that for timing? 2 minutes to go. So I would just give the opportunity to just do a little round of panel members, just to give you a chance to kind of sign off, but also just to make any further comments that you haven't had a chance to say already. So if I go to Mike, if there's anything you want to add. Oh, you're on mute.
Just to say once again, thanks to the community support groups. And I think the comment from Nigel was an excellent one about the need to keep sort of communicating with everyone and speaking to people, so that no one feels isolated. I think that's extremely important and something, we're going to focus on as much as we possibly can going forward. So thanks very much. Thank you. Thank you, Mike. And Laurie?
I don't think there's anything further other than from my thanks as well, but I just wanted to mention, and I think Amanda may have put it in the chat function, that there is a further webinar for the COVID support groups planned for the end of July, the 28th of July. That is being led by Warwickshire Carver, who Becky mentioned earlier, and is a partnership between the county, the boroughs and districts and Carver. And it's really about how we can further support COVID groups moving forward as changes and things as the pandemic progresses, really.
Brilliant, thank you. Jo and Sharon, anything from yourselves to add?
No, just to say we're really impressed with the way our businesses have taken all this guidance on board and the way they've adapted their businesses and they've embraced the test and trace information and gathering, and yeah, we're really impressed with them, really. It's all new for everybody, but they've really embraced it.
That's really encouraging.
I'd like to say that although this is a very strange time, it's been a great opportunity to do some partnership working with you all. So that's been really good positive for us. Thank you.
Lovely, thank you both. Margaret, and then to Neil, if there's any final thoughts.
I would just like to say that one of the outcomes, if you like, from this whole pandemic is that certainly in North Warwickshire, and I'm sure the same's true in Nuneaton, we've got now a list of vulnerable people. And I think this is something that's quite valuable in terms of support going forward. And I think as a borough, it would be good if we could maintain, with the community teams, maintain that list of people that need help and therefore be able to target volunteers to give the help to those people. Because I think in the past we've had little pockets of knowledge about who's vulnerable in certain areas, but now we've started to bring that together, which I think is very valuable. And thanks to everybody that's worked on this. It's been great.
Yes, thank you very much, everybody. I'm really impressed with what's been going on. This is the first webinar that really I've been involved with so many different groups, and I will be following up with Mike, the app, and all the context as Margaret has said, on how we can get through this, all the help that we can give, and also continue to do other things within the community going forward. Thank you, everybody.
Thank you, Neil. Fine words there. So we've had Nigel is sneaking in a final question before we do sign off. So I will give you the opportunity to ask the question, Nigel, if it's come in now.
Yes, forgive me. It was on the tip of my tongue when I was earlier speaking, but it's more of a medical question. Emily, you were talking about the 3 symptoms which have been going around really since March and April, but there's been a lot of other symptoms which are being muted quite seriously, and this is gastroenteral problems and severe fatigue, which are being flagged up in many of the other countries as a result of the developments and experimentation. I'm wondering, is there any more information that's coming through from public health departments with regards to those being symptoms that everybody needs to be starting to be aware of?
Thank you, Nigel. I say that's like no, that's fine. Yeah, I mean, you've highlighted the key kind of atypical symptoms there around stomach upsets and fatigue. We are alerting GPs at the moment, particularly around kind of severe fatigue. I think that one is quite often missed or misdiagnosed, so we're making health professionals more aware of that information. Currently, the national guidance is still to be focusing on those 3 primary symptoms. We can share some information after this. I'll get a bit of research collated for you and distribute it out through this group around any other atypical symptoms, but we are finding that the vast majority of cases it is one of those 3 key symptoms that they are presenting with.
Thank you for that. No more questions, I promise.
Thank you, Nigel. Well, I'm going to stop the opportunity now by signing off, but just wanted to say a final thank you from myself, as everybody else has said, really, for the fantastic efforts that we've seen throughout the pandemic period. Encourage you to keep going, try and keep your spirits up and keep supporting each other as we continue to fight the virus. We are winning and we will get through this. So thank you all for joining today. Thank you.